Good evening, and welcome to Manage Your Fears and Your Kids' Fears as the Pandemic Evolves. My name is Stacy Blaylock. I'm the Communications Coordinator for the Douglas County School District, and I'm thrilled to be here with you for this DCSD Parent University webinar. Presentations like this one aim to connect you with community experts who can help you build additional skills in supporting and empowering your children. And I think you're going to enjoy tonight's experts from our partner, Sky Ridge Medical Center. Allow me to introduce our guests. First, please welcome Whitney Kearney, a licensed professional counselor with over 10 years of clinical experience and a master's degree in counseling psychology from the University of Kansas. She's also the current director of outpatient programming at Health One Behavioral Health and Wellness. Dr. Jacob Benifla is a pediatric emergency medicine physician at Sky Ridge Medical Center and Presbyterian St. Luke's Hospital. He attended medical school at Southwestern University in Dallas. He served his general pediatrics residency at Dartmouth and performed a fellowship for pediatric emergency medicine at Emory. There will be opportunities to ask questions during the Q&A using the Q&A feature at the bottom of your screen. And at the end, our guests will try to get to some, and any that are left over will definitely be forwarded to them. So Whitney, why don't you take us away and we'll get started.
Thank you very much, Stacy, for the introduction. Thank you very much for having me here. I look forward to sharing some information and tips with you guys about staying emotionally healthy during this really unique time that we're experiencing, both for children and adolescents as well as parents. So go ahead and move on to the first slide. What to know. So in regards to what to know, we know that children and teenagers are perceptive. They're acutely aware of their environments. They're aware of both verbal and nonverbal happenings. And we want to be aware that they're cognizant of what they are being exposed to. In the therapy world, there's a phrase, the strongest nervous system in the room wins. So if we're bringing a strong sense of anxiety or sense of feeling overwhelmed, it's likely that our kiddos are going to be aware of that or perceptive that we're bringing that to the room. And so we want to be cognizant of what they're perceiving. Not receiving enough information about a situation or feeling left in the dark can actually increase fear rather than protect them from it. So that's one of the things that we're going to talk about today in regards to what to share with children and adolescents and how to share that information, but recognizing that this probably operates along a bell curve. There's concern in sharing not enough information, and there can be concern in sharing too much information. So we want to strive to find somewhere in that middle realm and giving them some information that helps them maybe reduce their anxiety and provide a sense of reassurance. And just a reminder that we are all in this together. This is really a unique time that our nation, world, community is experiencing in a collective format. On the next slide, we address what to say to children and adolescents, and this is really to all ages. So the following slide is in regards to specifically teenagers, because that can be a very unique vocabulary or approach that we use with them, but what to say to all ages. So we want to encourage or welcome a sense of questioning. We want to create an environment where they feel comfortable seeking information specifically in the home or from their parent or guardian. We want to set the tone for them to feel comfortable to ask those questions. So this can this would be creating an inviting environment, one that's free of distraction. So setting the tone of you being present to talk with them would mean that you set the cell phone aside, or you take a break from making dinner, but you create an environment where they feel heard and they feel like there's a platform to really bring those questions to the table. Taking cues from your child. So we want to be aware that we're not pushing the conversation on them or pushing away from the conversation. Take cues from your child's level of engagement in the conversation. If you can tell that they're becoming disengaged, and maybe it's a time to end that conversation and revisit it later. or if they're wanting to continue that conversation and talk about maybe things they've heard from friends or overheard on the news, then you provide an environment that might last a little bit longer than you originally anticipated. We want to encourage sharing of honest, factual, concise information. So we want to be honest with them, as opposed to providing an idealistic lens of what we're hoping might happen. We want to provide facts. So we want to steer away from providing a subjective account of what's going on, but stick with the facts. And again, try to share in a concise manner. So we don't want to overload them with information that they don't have the capacity or ability to process. Focus on what you're doing to stay safe. So I presume there's many families that are taking strong precautions and keeping themselves and their families safe. So whether that's wearing a mask when you go out in the community, if that's social distancing, if that's taking less trips to the grocery store, more frequent hand washing, whatever you're doing, have those conversations and have that dialogue with your kiddos to hopefully continue to provide a sense of reassurance. Keep talking with them, check in regularly. So we don't want to have one single conversation about how COVID or our current environment is impacting them. We want to keep an open door and maybe check with them on a weekly basis and see how they're doing, but give them an opportunity or platform to have those conversations if they want to. Again, a realistic and positive framing. So we want to steer away from idealistic lens. And honor, if there's unknown or uncertainty, that's okay to say so. We don't want to go ahead and ensure that school's going to resume in the fall and it's going to look like business as usual, because we definitely don't know that that's the case at this point. So realistic information is going to be most helpful. And also take a positive framing. So there's a lot of opportunity to focus on, sadness, loss, disappointment right now. And there's an opportunity to maybe frame that in a different light that allows us to take a more positive spin or promote a more resilient outcome to our circumstance. And share this information in a developmentally appropriate approach. So we know when we have a conversation with a 5-year-old about what's going on with our current environment, that's going to look very different than the language and style that we use with a 13-year-old or a 16-year-old. So we just want to be really cognizant in how we share that information and what type of information we're sharing in a way that is digestible for that kiddo. So on the next slide, we talk specifically about how to talk to or how to dialogue with teenagers. I work in a program, a full day program and a partial day outpatient program with adolescents, and validation of feelings is probably the number one kind of component or aspect that we talk about in regards to adolescents' relationship with parents. I feel like one of the most common themes that we hear is feeling as though they don't feel heard. And so validation of feelings, even if we might not agree with their experience, that is their reality at this time. So validating their feelings of anger, frustration, sadness, disappointment, honoring, it sounds like you're really frustrated that you're not able to go visit your friends right now. And I hear you. Even if we recognize that's ridiculous, it's not feasible, it's not something that's safe right now, continuing to validate their feelings is a really powerful response for parents. To coincide with that, I think it's really easy for a caregiver or a guardian to take a solution-focused approach of trying to solve the problem at hand. And I think that coincides with adolescents or kids maybe not feeling as heard. And so there's many times, and I would say probably very relevantly in this situation, where just hearing them out as opposed to navigating or helping them find a solution is really powerful. So I would say that validation is really the key component to this slide. Encouraging healthy habits. So we know we have a lot more ability to dictate those habits with younger kiddos. With adolescents, we don't necessarily have as much control over what that looks like. So we have the opportunity to encourage or promote those healthy habits. So that includes sleep, that includes eating nutritious foods when possible or in balance, socializing, if you see that they're more apt to become socially isolated, and finding movement, whether that's exercise or just more minimal movement. Also an opportunity to practice gratitude. Again, there's a lot of things to feel frustrated about right now, to feel at loss with. There's also an opportunity to practice gratitude. We know that it's really hard for us to hold in our head a negative cognition and a positive cognition at the same time. And if we change our thinking or our cognitions to more of a positive outcome, we're more likely to experience more resilience from our current circumstance. So possibly finding gratitude for the opportunity to be able to slow down a little bit, maybe practice some hobbies that you hadn't had the opportunity before. And so that would be one recommendation. And then future orientation. So trying to build a hopeful lens of what things could look like moving forward. So maybe planning a trip for next fall or next spring, maybe planning, if they happen to miss a birthday party, starting to plan what their next birthday party might look like. But again, future orientation that can instill hope. And then again, I put two other components on here that are not necessarily what to say to teenagers, but maybe how to respond to teenagers. Again, we talked about the importance of just listening as opposed to problem solving to ensure that they really feel heard in the circumstance. And then also the last one on here is to observe for signs of concern. I put that on here. We know that there's a significant rise in mental health concerns given, the unknown of what's taking place right now. We've seen an increase in anxiety, depression, increase in suicidal ideation and suicide attempts. And so I would encourage you to keep a really close temperature on behavioral changes and signs of concern or risk that you might be seeing in your teenagers. And on the next slide, we talk about behavioral changes that you might anticipate to see. These are behavioral changes that would fall into a relatively normal category given our current environment. So an increase in fatigue. This can be due to the overall stress that most individuals are experiencing, as well as an increase in screen time. Screen time is correlated with an increase in fatigue, whether that's meetings, Zoom chats, FaceTime, whatever it might be. But it's strongly correlated with a lot of the environmental changes that we're experiencing right now, which can be surprising to recognize, even though most of us are experiencing like less physical movement than we normally would. Regression, especially in the younger children, it's common to see regression right now. I'm hearing a lot of anecdotal reports about kiddos that are having a return in difficulties with potty training or increased need for attachment. They're more clingy than they normally are. This is correlated with what we're seeing. An increase in mood instability. So we might see a little bit more of a roller coaster of emotions, specifically in the adolescence, higher highs and lower lows. Recognizing the impact of the unknown. This is directly correlated with fear and anxiety, and that would be a normal response to the circumstances. Limited coping skills. So we want to recognize, especially with our younger population of children and adolescents, they might not necessarily be equipped with the coping skills to really adequately handle what they're dealing with right now. And so it's an opportunity for parents, for other authority figures to role model healthy coping skills, how to ask for help when skills or support are needed. And then articulation of multiple emotions. I know for myself, if I'm feeling more than one emotion at a time, it can be a little challenging for me to dissect what I might be experiencing internally, and that's as an adult. So I can only imagine when a child experiences more than one single emotion at a time, there's likely difficulty in articulating, first of all, what that is, why that is happening, and then what to do about it. So increasing the support, the emotional support that's available, and maybe helping them find the words to navigate that. Recognizing the change in social connectedness. So Many of us are taking part in FaceTime, Zoom calls, WebExes, whatever our preferred platform might be to continue to engage with loved ones and those that we care about. And it's important to recognize that we get a very different social feel from those platforms than we do if we were to meet our best friend, at the park or for lunch and get a hug. And so that's an important aspect to consider. And then also an adaptation of expectations. So there are many milestones out there that individuals have been looking forward to for a long period of time that aren't happening. So we know middle school, high school graduations aren't happening, proms, birthdays, recitals. We want to acknowledge that many of those that aren't taking place are having a significant impact on our kiddos and adolescents. So on the next page, we're going to address what do we do about this? We know that all these factors are taking place. How do we take action with this? So one of the things that we encourage would be modeling emotion regulation. And that might be a factor that's easier said than done. And we might have to fake it until we make it as an adult. But being aware, again, as I said on the first slide, kids and adolescents are very perceptive to their environments. They are going to see how we respond to these stressful situations and are likely, whether it's consciously or unconsciously, to model how we react to those situations. And so we want to be really cognizant. If there's a need for a meltdown, that we take that meltdown to the bedroom and we have that meltdown outside of our kiddos' awareness. But we recognize that that's going to happen, but do our best to moderate what that looks like in their presence. Keep routines in place. Routines provide a sense of comfort and safety and are very important. Those routines might look different now than they did when we were in the school year pre-COVID, but we want to keep routines in place as much as possible. They just might have a little more flexibility to them. We want to be creative with new activities. I imagine many parents out there didn't anticipate that they would become art teachers or science teachers during this period, but there's a real opportunity to get creative, maybe through Pinterest or YouTube, research activities, activities that really explore the senses, maybe activities that you wouldn't have had time to try previously. Find movement. So whether that is that small movement, like going for a walk around the neighborhood with the dog, or large movement, building an obstacle course at the local park or in the backyard, whatever that might be, we know that physical activity is strongly correlated with a higher sense of well-being and mental health. Limit exposure to the news and social media. So we want to be cognizant of how much ourselves and our children are exposed to the news and social media. There's a lot of information out there and there's a lot of conflicting information. It can be anxiety provoking, it can be confusing, that can be scary. And so we want to encourage you to stay informed, but do that in a very intentional way. Initiate meaningful screen time. So screen time is okay. Screen time is not bad. And so we want to encourage that and that it's done in a meaningful way. So whether that's sitting down for a family movie in the evening, playing a video game together, whatever that might be, but doing that in an intentional way. Socializing with friends and loved ones. We've talked about this a couple times. That looks different right now. So that might be over a Zoom call or FaceTime, but continuing to find that sense of connection as best as you can is really important. It's a really easy time for individuals to feel lonely. So try to fill your social cup in those unique ways as much as possible. And then also encourage agency through planning. So it's a time where many of us feel a loss of control. There's a lot happening in our environment that we don't have control of. And it's an opportunity for us to recognize what is in our locus of control and take advantage of that. So that might be allowing them to plan a senior adolescent, to plan the next family vacation, or plan new landscaping or planting flowers in the backyard, whatever it might be, but something that might provoke a sense of agency. And then the last slide here, we have parent self-care. We here at Program talk all the time about the analogy of the oxygen mask on an airplane and how important it is for the individual, the parent guardian, to place their mask on first before they can take care of another. And so we just want to reinforce the importance of the parents that are participating this evening to take care of yourself and recognize how important it is. In order for you to be able to give, you must give to yourself first. So remembering to take time for yourself, whether that's 10 minutes at the end of the day or maybe an hour at some point throughout the day, but finding that time to devote to yourself. Prioritizing healthy choices. So we addressed promoting or encouraging healthy choices in our adolescents. We also encourage you to role model that for your adolescents. I've seen a lot of memes recently on Instagram about increased alcohol use and using that as a coping mechanism. And I'm sure there's a time and a place for that. And just keeping yourself in check that you're continuing to make healthy choices. And if you do indulge in something like that, you're aware and cognizant of when you're doing it and why you're doing it. Be realistic with yourself. Again, parents are taking on many roles that you did not realize you would be taking on in this circumstance. So whether that's teacher or barber or chef, whatever it might be realistic with yourself and what you're capable of doing, and recognize you don't have to do it all, right? We do the best we can, and that's wonderful. That's perfect. Set boundaries. Say no to an extra Zoom call or to your kiddo's 5th request to play Barbies at the end of the day. Recognize what you need and set those boundaries and know that that's okay as well. Reconnect with things that you enjoy. So again, this can be a great opportunity to role model for kids to explore hobbies that they might not have participated in before. Maybe find that book that was on the back of the bookshelf that you've been meaning to read for 3 years now and pull that sucker out. Mindfulness and breath. So this is really important. We know with mindfulness that this is one of the major tools or the primary tools in helping us manage and regulate anxiety. Anxiety is bred in future orientation or past orientation. If we are able to take a really present focus, we have a huge opportunity in controlling our level of anxiety. And that there's a couple approaches to do that. One of those is really focusing on sensory awareness and utilizing all 5 senses in the present moment. Being aware of our breath is also a really powerful tool of bringing us back to a present orientation. So there's a lot of great breath work and meditation apps and activities out there. Also, give yourself space to feel. It's okay to feel overwhelmed. It's okay to feel angry, frustrated. Just as you want to validate for your adolescent or child, please give yourself the space to do that for yourself as well. This is an unprecedented and very unique time that we're going through, and it's not easy. And recognize that it's okay to ask for help if needed. We live in a society or culture where it's at some point was deemed a weakness to ask for help. And that's so far from the truth. It really is a step of courage to recognize, hey, I have a little more on my plate than I'm able to deal with right now, and I need some extra support. That's not an easy thing to do, and there are a lot of resources out there to help support you in that path or journey. So on the next slide, I listed a couple of programs that we here at the Behavioral Health and Wellness Center offer. So on the bottom portion there, we offer inpatient programs for adolescents and adults, as well as senior adults. We also have PHP as our partial hospitalization or full day programming, and then our IOP is our intensive outpatient program. It's a partial day program for individuals that need a little more support than 1 hour of individual counseling a week. But they don't necessarily need inpatient care. So both of those programs are available. We also offer a mom's mood group on Mondays. It's 1 hour a week. It's a support group. It's open to all community members. There's no cost for this. It's a wonderful resource to utilize. And then we also have 3 new programs that have opened within the last couple months. We have a women's inpatient unit that's specifically for women that are experiencing a difficult time and would benefit from a female-only environment. We also have a women's IOP track. So again, this is for individuals that are in need of a little more support than 1 hour of individual therapy a week. And effective June 1st, we're going to be offering a bi-monthly parent psychoeducation group. Also, like our moms group, this is open for all community members. You do not have to be affiliated with any of our programs to participate in this. It really will be a hybrid of psychoeducation and support for parents that are just in need of some additional resources at this time. In addition to our programs, there are a variety of behavioral health agencies and organizations out there that offer great programming. So again, resources are available. On the last page here, I've identified some additional resources that might be helpful, some parent tip sheets, and then there's also an opportunity through childmind.org is a wonderful website. They have a great amount of information on there. You can sign up for daily emails for parents to best support their kiddos during this time. So those are the resources that I'll leave you with here, and I'll be passing the microphone off to Jacob.
Sorry about that. Just had to take a moment to unmute. So I think that was a really great talk. Brought up a lot of outstanding points, really things that we're encountering in the emergency department all the time. You know, we talk a lot about contagion theory for example, for when children have to have procedures, or even honestly, even just visiting the emergency department can be experience for the child and for the adults as well, for the parents who bring them in, and but modeling that behavior can help out with that. And I think a lot of what you're saying, or really all of what you're saying, applies to this current pandemic crisis, but it absolutely also applies to many other circumstances. It's just good advice. We certainly want parents to feel comfortable going to the emergency department because it is a scary time. But our concern is that if parents wait too long to go to the emergency department because they are concerned, that could have them take their kids at times when it may be a little bit later than we'd like. So for example, we're seeing some children with ruptured appendicitis, and parents are telling us that they were avoiding coming into the emergency department because they were nervous about being exposed to corona. And we're taking all those precautions to keep kids safe, to keep parents safe as well. But it's important for the health and well-being of children, both, and of course, emotional health as well, that if they need to go to the emergency department, that it's safe to go. I think Stacy,
Thank you, Dr. Benifla.
Sure.
Let's see, if anyone has a question, we invite you to click the raise hand on the chat, and we'd love to start a conversation with you. And yeah. In the meantime, I have a question for you, Whitney.
Sure.
So you had mentioned that some of the struggles that come with supporting teens and adolescents right now is missing those major milestones. So missing graduations and whatnot. What would be your advice and additional resources that people could look into to help through that particular struggle?
I think that there's an opportunity to create a shared experience with others that might be going through similar feelings of missed milestones. So trying to get creative in acknowledging what it is that's happening in a safe platform. So I know a friend of mine is a teacher in Cherry Creek. And she has coordinated a small group of individuals, the high school seniors, to gather in the parking lot in a socially distancing, safe way to celebrate their graduation. So still finding a way, given our current limitations, to recognize those experiences, I think is going to be really powerful. And doing that with others that are going through the same circumstance, I think is a way to find meaningful connection.
Did you have anything to add, Doctor? No? Okay, we do have a question from Lisa McCoy. How do I explain to my child that the outside is safe as long as we are taking the proper precautions?
Did she identify an age for a kiddo?
Not right now, not in her question.
Okay.
Lisa, you're welcome to send in another question if you'd like to provide that information. 11 years old.
Jacob, do you want to take that one since I took the last one?
Sure. So, I think clearly can depend on your 11-year-old, but I think most 11-year-olds have, as Whitney was speaking to earlier, a far better understanding. They can understand things a lot better than, say, a 5-year-old could, of course. So I think you can speak to them about that, that we can take the proper precautions and that we can minimize the risks, and we can be outside and emphasize the importance and the healthy benefits of actually being active and being outdoors. But I think with an 11-year-old that you can be pretty straightforward and honest with them about this.
All right, I do have another question from Claudia. Can you give us advice on how to balance work and children at home with no activities during the summer? I have a demanding job, lucky to work at home, but I am worried about struggles to keep my 7 and 9-year-olds busy and engaged.
I first want to say kudos to you for managing working at home with a 7 and 9-year-old. I can imagine what that is like, and how you try to find balance with that, because that's a tricky one to begin with. I would say I briefly mentioned the importance of structure and routine, and I would say that would probably be my biggest recommendation. For a lot of individuals that are struggling with that, we might make a schedule. I think for 7 and 9-year-olds, having a visualization, something that they're able to reference and look at, could be really powerful in regards to a schedule for the day, and building that into 1 hour, 30-minute chunks that they're able to reference, and mixing up those activities in a way that might be educational versus activity-based versus screen time, would be my recommendation.
Okay. And I do have a caller here, Shannon Scanlon. You're welcome to ask your question.
Oh, hi, can you hear me?
Yes, we can.
Oh, okay, hi. So I'm actually a doctor of clinical psychology myself.
All right.
Yeah, but it's been really interesting because I've noticed a lot more anger in my children. I have a 9-year-old and a 12-year-old, and my 9-year-old just turned 9 on May 5th. And he said to me, he was crying in his bedroom. He said to me, "Mom, Corona ruined my birthday." And I felt so bad. So I just wanted to say thank you for you guys to mentioning that. We try to do balloons and cake and this and that, but I said, "Are you feeling sad?" And he said, "Yeah, Mommy, I feel really sad." And so it's not just the kids graduating, it's literally, 9-year-olds' birthdays.
Mm-hmm.
That's a significant milestone for a 9-year-old.
Yeah. And he's stuck in the house, and we have 2 friends that have the COVID, and so we can't go anywhere. Mm-hmm. But it was really sad. It broke my heart. And, as a therapist, I'm usually really good at dealing with other people's problems. But when I saw my son hurting, it was so painful. I did what you said. I went in the other room and cried by myself.
I'm glad you let yourself have that space. That's important.
I did, but you'd think as a doctor of psychology that I'd have this down put, and, I've written books on parenting and blah, 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 but it's still, I feel depressed. I mean, I say to my husband, I just feel depressed.
Yeah, we're still all human at the end of the day.
Yeah.
Yeah.
So thank you for this. I've never heard of your group before today. So we're new to Colorado, but I really appreciate your advice and your words, and you've spoken very well. So thank you.
Yeah, thank you.
Well, thank you, Shannon.
Yeah.
All right. Does anyone else have any other questions they'd like to submit at this time? Well, I'm going to take that as a new. Let's see, if you have any down the road, you will be receiving an email from me, and you're welcome to send over the questions to me and I'll forward them on to our guests. That being said, all the resources you've learned about here today will be available for you to reference and visit in the future. And yeah, I'd like to take this time to just authentically express my gratitude for Whitney and Dr. Beniflaw. I'm very thankful for your insights and your expertise and for sharing it with our community. So thank you very much.
Yeah, thank you very much for having both of us here. I hope that it was helpful and there were some tips that you can take away and some applied strategies, and really just a normalization of it's okay to feel overwhelmed, and it's a tough time for all of us.
Absolutely.
Right.
And if you are a parent of a DCSD student, we do have a town hall tomorrow evening at 5 p.m. and it's going to be talking about social emotional learning and supporting our special education students. I'd be happy to share that information with you as well, if that is something that interests you. So have a wonderful night, everyone. Thank you for joining us. I hope you have a good evening.
Thank you very much.
Thank you.